Andy Johnson, here we are. Here I am talking about mental health issues, something I never wanted to talk about, but here I am talking about it nonetheless because I think it's important that we begin to address this. Now, I've been working in higher education for over 25 years. I've had a mental health condition, anxiety disorder, and reoccurring depression. And I've been successful most of the time, sometimes not, because of this condition. Been in education 37 years total, and at least 11 of these years, this condition that I have was undiagnosed. And this condition has gotten in the way, but let's understand what it is. It's not talked about enough. There's still a personal stigma attached to it. They'll think something's wrong with me. They'll think I'm a broken china doll, that I'm a monster, or somehow that I'm not as I should. That personal stigma, especially when I was younger, I didn't want to talk about it. I kept it hidden. And the professional stigma, I won't get a job. I won't get promoted. I won't get tenure. All right, it's that fear. And in talking with a lot of professors, when talking with professors who have this condition, many of them are still afraid to get some sort of accommodation for it because of the personal and professional stigma attached. Now, I don't call it mental illness. I call it a condition. I refuse to be a category in someone's diagnostic manual. It's part of the human condition. It's a variation on the human theme. There's no such thing as normal. Normal is a myth. It's the way we are wired, the way I was wired. Now, I didn't ask for this condition to be inside of me, this wolf thing, this whatever it is. There are both positive and negative aspects of it. When I was a competitive athlete in high school and college, the angry part really helped compel me. And in some of my professional and writing endeavors, a certain amount of energy that I got as a result of this condition. But it does get in the way of human interactions and the depressive episode as well. And again, people with a mental health condition, it's not like we wanted to have this condition. Now, the whole idea of disability, it's a social construct based on the idea of this is normal and you're not it, you're deficient, you're deviant, therefore you have a disability. A condition becomes a disability only when a restriction or an impediment is put in place. A person in a wheelchair, that's not a disability unless or until you don't have the ramps up, you don't have the elevators widen, etc., etc. So a condition becomes a disability when restrictions or impediments are in place. Now, mental health condition is a non-visible disability. It's there, you can't see it. There are conditions and impediments that we can get rid of so everyone can achieve their full potential. At some point in their lives, 1 out of 4 people will experience a mental health condition. It is not always permanent. Sometimes it's related to this, that, or the other thing. Why should we talk about it? Well, the second leading cause of death among college-age students is suicide. Third, with high school students, to say nothing of drug and alcohol abuse. 3 common misunderstandings. Just get over it. That occurs especially with depression. Just get over it. Well, if we could, we would, but we can't just get over a condition. We just can't get over it. You can't take a pill and make it better, make it go away. It's not like having a illness of some sort, all right? Psychotropic medication by itself rarely works. It gives you a buffer where you can begin to address the issue. Oftentimes it takes talk therapy with medication, with hard work on the individual's part, hard work and discipline, and constant vigilance. That has been my experience. And another myth, it's precise. Like a physical disease. There's a standardized experience. Therefore, you have a standardized treatment. It's not. It's a little bit different. People with depressive episodes experience it a little bit differently. So, the experience. The most common ones are depression and some form of anxiety. And anxiety comes in a variety of flavors, and I'm going to describe exactly what that is in just a minute. And then a bipolar disorder, usually called manic depressive. That just means there's stages where you go through manic episodes and depressive episodes, and there's varying degrees of severity here with bipolar disorder. And more common today is post-traumatic stress disorder. But depression and anxiety and by the way, substance abuse is a mental health disorder as well. We see more of it today because we know what it is. So of course we see more. We're more aware of mental health conditions. And comorbidity, more than one condition. Anxiety and depression often go together, but chemical substance abuse often goes together. One thing causes the other, but people with anxiety especially try to self-medicate to make it go away, but that just covers it up and makes the condition worse. Comorbidity, experiencing two or more conditions at the same time. And back years and years ago, we just medicated so you don't see the anxiety. You don't see the depression. And years ago, we just thought people were kooks or kind of a-holes or this, that, and the other thing. We know more about the condition today. So, of course, we see more of it today. Now, an anxiety disorder, I explain it like someone coming in behind you and saying, boo, that reaction you get. It's like having that experience all the time. It's that fight or flight mechanism that becomes dysregulated, where you get up higher and it takes you longer to come down or to achieve homeostasis. I don't like the term anxiety because people associate that with worry. Oh my gosh. And sometimes anxiety is fight or flight mechanism. Now that serves you well if you're competing, but not so well if you're interacting with other human beings all the time, especially in a personal or professional environment. All right. Depression really sucks. Your brain just doesn't work. This overwhelming sadness and it's like being in a dark hole. And sometimes it manifests in anger, irritability. I know when I'm slipping back into it because I swear a lot. All right. So yes, sometimes it's overwhelming sadness, hopelessness. You just can't function. You can't sleep. You can't eat. And another one is suicide ideation. Ideation means you think about it. Doesn't mean you're going to contemplate the act at all. You just think about it. You think about death and dying and so forth. Those are some of what depression is like. Just in a dark hole. And it sucks. Both can have physical impacts. Meaning, your sleep can be disrupted. 4 hours a night, 2 hours a night. Oh boy, that's horrible. Sleep is like the reset button on your brain, and if you can't sleep, you just can't reset. I have had to go to the emergency room because you get so tense, your back tenses up, and you just are in pain. So both of these can have physical impacts where you're not able to function. All right, just a little insight into mental health issues.